Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. Today, I have quite again another great guest in the building today, talking about something. I know we're talking about communication, but what we're really talking about is trust. And I have someone who's been doing this for a very, very long time, Darolyn Davis. Thank you so much for being here. I really appreciate it.
Well, Corey, thank you so much for having me. I'm excited to have this conversation with you about this very important issue.
Yeah, and for me as a public health professional, this is something that we talk about, or we should talk about more. But it's something that you hear about within the crowds that I roll in a lot, and it's this communication piece. Um, Darylyn, when did you first notice this disconnect between what officials communicate, right, and then what the community actually resonates with?
It's a it was an eye-opening moment, I guess, in my career. I was working in the California State Legislature, working for the assembly member and Speaker of the House at the time, and had the privilege to be at the table in the room to watch these public policies being crafted and put together, and seeing who was around that table and how those decisions were being made. And it became really clear to me that there were missing pieces. There were well-intentioned people wanting to do things to improve generally the quality of life for others, but the messaging and the sense of the public policy makers, they didn't reflect how people actually felt and how
Mm,
they lived. You get your echo chamber of folks in a room, and they may have a particular bend about an issue. And I noticed that there were often not always women in the room. There weren't people of color in the room. Even though I worked for a man of color, there was just not that representation in the space, so that you get these lived experiences and impacts, the unintended consequences of a policy. I mean, you look at Prop 209, you look at some of the other policies that had some really detrimental impacts, and those were not intentions, but it was because of the lack of diversity in the space. This disconnect really pushed me to the work that I eventually ended up doing for the last 30 years, which DNA Communications is really bridging that gap between public policy and the communities that it's supposed to serve. I wanted to build that bridge of conversation. And I built an equity first agency with that intention in mind, that all people should have a voice in this conversation. They pay taxes, they live in a state, and they should be represented in the policies that are developed. And so that is how we got to this point of me being there and seeing how things were working and knowing that there was a gap.
Yeah, so I want to make sure that I'm hearing you, because this is something that is kind of, for lack of a better word, kind of irritating. Darylyn, is like there are people that make decisions about communities and spaces that they've never been in, or been so far removed from, that they don't remember what it was like to be in certain situations. And they're just not listening. But I love your equity first approach. Can you explain what that equity focused communication strategy is?
Well, it really starts with building around real people. It's about lived experiences. It's about asking who is being impacted, who is being left out, and the barriers that they're facing for around those particular issues, and what is going to make their lives better. What is the quality of their life? How can we improve it? So that is where we really focus our attention around, um, what it means, and how do you build trust, access, understanding, and especially in public health and education and transportation and workforce, and really designing strategies with communities in mind. I mean, it's not just for them, it is with them. And really thinking about how the language you're using and the tools that you're using and the process that you're using, and
Mm.
how you're showing up as a vehicle, and how you measure that success at the end of the day. And so whether you're really making impact, and that's really what, I believe in what our agency is focused on is ensuring that every voice has an opportunity to be heard in a meaningful way. It's not just having a meeting, it's more than that.
Yeah, and definitely correct me if I'm wrong because you've been doing this a whole lot longer than I have. But what you're doing and what you've been doing for so long sounds easy, but it's not it's not easy. A question that I have is, you hear a lot of organizations or agencies saying on one hand that they want the input from community, and the community sometimes feels like they're being ignored.
Yeah.
Where do you feel like there's where are we missing there? What's happening there?
Well, a lot I think has to do with why do people feel they're not being heard? Because
Mhm.
usually the decision's already made, or
Right.
certainly the framework of that decision has been made already. And so oftentimes an agency or a client, they just want people to do what they want them to do. And
Right.
they forget in the process of the conversation that they're getting information that may not align. And so, communities are asked for feedback that never shows up sometimes in the outcome of a project or a policy. And you wonder, people are wondering, well, was my voice really ever heard? And I've seen organizations generally be surprised that the community pushbacks about, an initiative or a policy that people really were just gung ho. They think this is great for these people. They're going to love it.
Right.
And in fact, that they haven't listened. There hasn't been any real listening, not a lot of follow through, and they being honest about what their feedback and how it will change and close that loop. And so I think agencies and organizations have to be really committed to wanting to hear and act on what
Mhm.
they hear to create the policy or the change or the adoption without the pretense that these are just players in a game. If I just give them this direction, they're going to follow me here.
Mhm.
You have to understand people's lived experiences and what they're experiencing on a day to day basis to know whether it's going to resonate or have any positive impact.
Yeah, I've seen that so many times of you couldn't tell me this initiative that I created was gonna just change the world. I knew it was gonna be the best thing ever. I was practicing my Nobel Peace Prize in my speech, and then totally missed the mark. It'd be like, wait a minute, what's going on?
Yeah,
Like
yeah,
it's
it's
so
so
true.
true. It's so true. And sometimes agencies get so offended and
Mhm.
organization gets so offended that these, and then we get into a whole different conversation about people placing their priorities on a group of people, you know.
Yes, yeah, and like you kind of understand both sides because you're working for an organization, you have your goals, you have things you want to hit, and sometimes that doesn't really align with what the community you're trying to serve is saying that they want or need. But where do well-meaning people these well-meaning initiatives and these outreach efforts, where is there one piece where you say, you're missing the mark right here, or like what is the how do they where are they failing? Is there one thing? Are there multiple things that is just failing from the jump?
Yeah, I think that outreach fails when it's treated like a distribution problem instead of a relationship problem,
Mm,
and when you're thinking about public agencies, the job is done just because the information is out there. It's not the answer. It's just because I sent out this information, you got a mailer, or you got a phone call that somehow,
mhm,
or there's something on a website that somehow there's, and without any follow up or follow through and no connection with real people. So it is where it fails is not connecting and really understanding the culture, the uh, the history, and a lot of times in with public health, communities still don't know where to go, who to trust,
Man,
what their options are, even though technically the information exists, and so that access and understanding are not the same thing. And so I think it's just really important that you spend the time to get to know your communities, and not in a perfunctory way, but in a real,
mhm,
that kind of coffee conversation to understand, if I'm a family that I have multi generations in my household and I'm managing, I can't get to work and I can't, these are my pressures, and not
right.
understanding that, I think, is where the efforts actually fail.
Yeah, trust takes time.
Yeah,
Trust takes
it does.
time. What changes when we stop treating trust as this personal choice and start seeing it as an institutional responsibility?
Well, a lot changes actually. When trust is treated like as a personal choice, the burden often is put on communities. And, it becomes, why don't people trust us? Our clients ask me, well, why don't they trust us? Why aren't they showing up? And instead of asking, what are we doing that might be pushing people away?
Mhm.
And but when trust is treated as a institutional responsibility, the question shifts. It really does change from, what are we doing that earns trust, and how are we showing up? What's the experiences? And are people having when they interact with this organization? It's particularly in public health, this is critical because people's decision about vaccines and screenings and pregnancy and emergency care, all of it is shaped by trust. And
Mm,
people
mhm.
don't necessarily distrust healthcare for no reason. There is, historically speaking, there's a reason for it. And
Right.
especially in communities of color where, unethical testing has been happening, misinformation, they've been excluded, people have been excluded from clinical trials, to being ignored or dismissed, overall in exam rooms. These are systems were not built with everybody in mind. And so Black women particularly are still 3 or 4 times more likely to die in emergency
I
rooms.
know, that just insane.
Yes, and as you compare it to white women. And when it comes to clinical trials, the research that shapes our healthcare system, people of color are still largely left out. And so Black Americans, they make up about 14% of the country, but only about 5 or 7% of trial participants, as you very well know in your
Mhm.
round and field. And even something as basic as pain treatment, Black people are not, their pain is not recognized and oftentimes in a hospital
Mhm.
setting, and it's oftentimes ignored. About 22% less often as it relates to pain. So when some people, when walks into a hospital room and is carrying these experiences, their own and those of their family members, that history matters, and it does frame how they trust and believe in the institution that they're, when you talk about, whether it's a personal choice of trust or not, there's a lot of background there.
Right. Darolyn, with over, 30 years in this work, what problems keep showing up?
That is the $1 million question. The list is long, it really is, but it just means unfortunately, it means that we have to just continue to do the work that we're doing.
Mhm.
Communities are brought in way too late. Equity is treated like a checkbox, like it's something we got to do. Decisions are moving faster than relationships. They're not slowing down and really understanding. and budgets are far too small to do public education and engagement. And oftentimes everybody wants it done tomorrow, and it
Right.
takes time. It takes time, and organizations often misunderstand and underestimate history and how it impacts people's perceptions. And so people remember what happened 10, 20,
Right.
30 years ago. And if you don't build trust without acknowledging this history, you have missed the mark.
No, that's real. And it brings up my next question, with organizations and agencies, not really recognizing some of that history in our country. Have you noticed how hard is it to earn that trust back, or how fast can you lose that trust?
Oh, we all know how quickly you could be at the top and quickly at the bottom.
Man.
We've
Mhm.
seen that. If nothing else, we've seen that in the last year.
Right.
Every day it seems to be happening. Like, someone has this great relationship with the community and with the world, and tomorrow you are
Uh-huh.
under the jail. So, in a sense, it's so easy to lose and it's so hard to build. And we're doing this around the world. We have built relationships with countries around the world that are now hundreds of years of work is gone.
Mhm.
And so, yes, it is easy to lose by just a word
Yeah.
or one action. So, and it's difficult to earn. It takes years to build, and it can be lost completely. People feel misled or disrespected, and that story really spreads around, from family to family. And it's absolutely become part of a community collective memory that you rely on. So, in new projects is building on what came before, when you're building. So, it's always good to monitor the online chatter, news, and building relationships with community-based organizations is really important. I think that helps build trust. We don't typically
Mhm.
go to neighborhoods that we don't have existing relationship alone. We always tap into community groups that are working in those communities in those neighborhoods to be our partner in a meaningful way.
Yeah, I want to touch on something real quick that you said earlier. And you would think in the year 2026 that agencies or organizations would understand that everybody is watching. Social media is everywhere. Everybody's watching, and it takes one 30-second video to blow your whole world up.
Yep, everything. And
Yeah.
whether true or false. I mean, whether true or
Yeah.
you still have to react,
Yep.
and sometimes it can be false, and we've all seen that there's misinformation out there, and to unwind misinformation is as complicated as saying something inappropriate or doing something inappropriate.
Oh yeah. Oh yeah. The amount of public health misinformation on social media is it's just crazy. And it's just one, it shows the gift and the curse of social media, right? Like things can spread like wildfire in a positive way, but it can also really hurt communities if the wrong information gets out there. So you can see it on both sides. My next question, what do agencies typically get wrong when they look at community engagement data?
Well, it's about sometimes they're just counting numbers.
Mhm.
We had 5 meetings. We sent out 20, pieces of mail. We had 25 posts, and as if that data tells them anything about impact, because that doesn't tell you anything about impact unless you're actually intentionally measuring from the beginning and when you start and when you end. That's the first, because most time projects don't allow for the research part of the work, and which really tells you what the numbers are. So looking at the numbers, they're missing so much of the nuance of how people are feeling. They miss the real stories, and One of the things that DNA excels at is interpreting community feedback into actionable recommendations. We always do a very intensive report at the end to guide our clients to what is next.
Mm, mm.
And they use that and leverage that information to further their agenda and their objectives. And so I think it's incredibly important to invest in measuring based on sentiment and feedback from the people who you've been engaging with.
Yeah, that's interesting. Because one, I agree with you. I think that's awesome. But like, I also think too, like, wouldn't that feels like that takes a lot of time to measure something like that? Because it's easy to measure how many people were there, or those numbers are easy. But it almost sounds like you're kind of measuring the feeling of the moment or the feeling of the communication.
Yeah, and whether you actually had impact. I mean, it doesn't
Yeah.
just because 100 people show up doesn't mean that you've moved them and behavioral change
Right.
one thought to something else. So you have to, and oftentimes their budgets don't allow for that. So the data is really not as accurate as it should be and or reliable, because then you're counting on someone's perspective and their lens, with the lens that they look through. Because one person could say something and my perspective of what they said may be one thing and you may see it completely different.
Right. Right. No,
Yeah.
that makes sense. That makes sense.
So if
No, sorry, go ahead.
So I was just going to say, you know, having that luxury, and it is oftentimes a luxury, but it's something that we insist upon to invest in, really knowing, because we want to know that we have made a difference.
Right. No, that makes sense. No, I love it. I love it. Who gains from kind of this superficial community engagement? Does anybody gain anything from that?
Well, in short, public agencies initially, I think, believe they gained because they've checked a box. They've said they've held meetings, they sent notices, they asked for feedback. On paper, it looks like outreach happened, but in the
Mhm.
long run, everybody loses. When engagement is really superficial, when agencies talk at communities instead of listening to them,
Mm, mhm.
people see right through it. They do. And it enforces the belief and the distrust within that community, and that their voices don't really matter, because you're not really creating the relationships and the getting the decision making that you're looking for to change or to move someone from one place to the next, or the information. And the sequences are real. Projects face many resistance and misinformation. Misinformation spreads very fast, as we were just talking about, and policies fail really because they weren't shaped by the lived experience of the people that they want to impact. Communities disengage, agencies spend more money and time and damage control, and public confidence continues to erode and decline. So there's no really win-win scenario in this kind of situation when you do superficial engagement. You really have to do meaningful engagement where agencies truly care about the community's outcome and the tools and making good decisions.
Awesome. Awesome. Can you describe a time when genuinely centering community voices actually changed the result?
Yeah, I get my I think one of my most proud projects projects that I'm most proud of in the Bay Area in San Francisco. There's a neighborhood called Bayview Hunters Point. It's where the shipyard was, and why many people migrated from the South, came to California to work in the shipyards during the war, and it became the highest homeownership is in this neighborhood, but it was also the most neglected neighborhood because of all the contaminants from the shipyard.
Mm,
They put the wastewater treatment plant in the neighborhood. They put the power plant in the neighborhood. So there were a lot of health issues, and one of the trade-offs for doing that was that the community accepted a community center, that the city, the public agencies would build this big community center. It was made out of concrete. It was 5 stories high, and they wanted workforce development. They wanted a community space. They wanted education opportunities there, that the community college would be there as well. And they got it. I got it. But it was never really maintained well. And so it was in a concrete space, so it was very cold.
Mm.
Big space. They did have programs that some were kind of working well. Well, after, 30 something years, we're now in technology. You can't get internet there. There's no
Oh, yeah.
working elevators. The space is not conducive to community participation and involvement in a hub. But the community was so afraid and so the public agency, let me back up, the public agency who built the center wanted to build a new center for the community, completely new and in a different, not less than a half a mile away. The community said, no, we don't want it. We don't want it because we don't trust you. Trust that you're going to put us out of this building. We're not going to get anything. And we will now be without even this particular space. And it took me about 6 years to
Wow.
work with this community to help them to see what they could have and the future, and to build the trust with these women and men who had been going to City Hall, banging their hands on the table, their fist on the table about equity and having a facility that would provide the services that this community needed. In the long run, we were able to build a $62 million state-of-the-art community facility with health care, health
Wow.
education, workforce training, art institution installments, CBO offices, shared workspaces. And so it's now the jewel of this neighborhood. And it is outstanding. And if you ever get to San Francisco, I would encourage you to visit the Southeast Communities facility. It is outstandingly beautiful.
Wow. Well, one thing I want to acknowledge for those listening or even watching is you hear the $62 million facility, but you don't hear the 6 years it took to build that trust. That is a long time to get the trust and to let people feel kind of take their guard down a little bit. What built your endurance for a race like that, to like keep going, to keep pushing, to build that trust?
I come from a family that is very focused on equity and inclusion and fairness. And I knew Espanola Jackson was a tiny little lady who she seems like she was 6 feet tall. She was that person that showed up every meeting until the day she died to fight
Wow.
this community. And I said, I have to do what I can do to ensure that this community gets this part, at least for the future. And just looking and being in households with families, talking to them, and working with them to see what is possible. And they had to believe in me, that I was being honest, and then I had to make sure that our client showed up to be honest and demonstrate. So I think it's the fact that this community deserved it. They deserve to have a state of the art like every other, because every place around them, technology was growing, and these new brand new
Right.
facilities were being built all around this neighborhood, all around it. That this community deserved that as well.
Man. So it sounds like there's a lot of pressure on you in that moment to make sure what you were saying that these people were going to do, that they were actually going to do it.
Yes, yes. So, that, and that's really a lot of our work, is that people trust in what we say as an organization, as a company, that I don't take on projects that I can't stand behind.
Mm. Mhm.
that's where I cross where the line. I don't cross that line because my trust and reputation is on the line with the communities that I engage in, and that is really important to me.
Yeah, no, I can tell that is amazing. That was a great story. And what I pulled from that is, community trust and building these relationships is gonna take longer than a week, a month, a year. It takes time for people to take the time to want to hear what you have to say. So I really appreciate that story. Before I get you out of here, I want to thank you so much for being on the podcast. But before I get you going, there are a lot of public health leaders, professionals, health executives that listen to this podcast that are looking to build the trust within the community, create their own campaigns, things of that nature. For that public health leader, what should they ask themselves before launching a campaign?
I think that the main and the most important question is to ask yourself who is not at the table, who is not represented, before we start this conversation of resolving or addressing an issue. Like, do we have the right voices here? Are we listening? And it's not easy to do because you may not know who those people are, but it's your job to know who they are if you're really serving them,
Right.
right? So it's very convenient to just stay within your group. And that happens oftentimes. We just kind of talk to each other
Right.
and think that we're going to have this enormous impact. And so it's always to ask, who is not at the table and who should be at the table.
No, I love that. Darolyn Davis, thank you so much for being on the podcast today. For those that are listening that want to learn more about you and your organization and connect, where can they find you?
davisimpact.com. They can look us up on the web, and we have lots of great information, not only about our current projects, but we do a lot of thought leadership around public engagement and equity.
Awesome. And as always, I will make sure I have those links in the description of this episode on all the audio platforms and YouTube to make it easier for you guys to reach out. Again, Ms. Davis, thank you so much for being here on the Healthy Project podcast. I really appreciate it. And everyone, thank you for listening. I'll highlight you next time.
Thank you, Corey.